On the Siksika Nation east of Calgary, there is a new normal under COVID-19. Members are screened, tested, and educated about the virus with their specific needs in mind.
With Siksika, we might have 10 or so in a household. So because of the dynamics, that's why we kind of test more. That's why we contact trace more people.
More than 5,000 tests have been done in the community of just 4,000 people. There was an outbreak over the summer, but cases were kept to a minimum, just 31, and no deaths, thanks in part to the nation's extensive emergency plan.
Trailers that were built for the 2013 floods as temporary neighborhoods for the flood affected Siksika Nation members. We renovated 19 of them in a way that if a family needed to be isolated.
The leadership on this reserve knew that if COVID-19 was able to take hold, the consequences could be devastating. It wasn't long ago that the H1N1 pandemic hit Indigenous communities hard.
Those stories the impact was traumatizing. We had communities in northern Manitoba that were not having supplies sent, they were having body bags sent.
Because Indigenous communities have higher rates of chronic illness and often lack access to services, local leaders had to make decisive moves fast. And that, according to a new paper published in the Canadian Medical Association Journal, may have made all the difference. Travel into Indigenous communities was restricted, and young Indigenous influencers were tapped to spread the message.
Only you and I can protect our future.
The result was a first wave where Indigenous communities came out relatively unscathed. A success to celebrate, but not to rest on, as communities like Siksika await a possible second wave. Heather, Yourex-West Global News on the Siksika Nation.